Hi, I'm Dr. Ashoojit Kaur Anand. I'm the Clinical Director at PCMH Restore Health, Bangalore, and the Founder Director of Aviksha, a home-based primary care at PCMH Restore Health. My expertise is in HIV, palliative care, and the elderly care. So the HIV virus multiplies within the CD4 cells. And as it multiplies within the CD4 cells, it destroys the CD4 cells once it liberates the millions of virons into the blood. And these destruction of the CD4 cells, the CD4 cells are the ones which give our body the immunity to fight against infections. As these CD4 count keeps on reducing because of the multiplication of the virus, our immunity keeps dropping down and we are prone for number of infections, which are called the opportunistic infections. So a low CD4 count means a lower immunity, means more susceptibility to other opportunistic infections. High CD4 count gives us a better immunity and protection against various opportunistic infections. But it is more important that the virus remains under control. That is, we need to check our viral levels very often to know if the drugs are working well enough. Because if the viruses are low in number, the destruction of CD4 cell comes down and thereby improves the immunity of the person.